Marriage gets hard when you disagreeing. When God's in the center, he's refereeing. Talk about triggers and traumas while having date nights at the gym and the sauna. To business meetings discussing the health of the wealth to the season of commerce.
New beginning, prosperity, abundance. Family will continue to walk by faith, not by sight. We know that God will supply. Beginning, prosperity, abundance. Family will continue to walk by faith, not by sight. We know that God will supply.
Hello.
Hello, welcome to Marriage, Family, and Business Live. For today's subject, I'm Katina.
I'm Vernon.
It's been a while. It's been a long time. We've never been live though. So.
Yeah, something new.
Yeah.
Oh, we not even there. Hold on. Let's do it now. Transfer it. There we go.
Awesome. So, welcome to our live. Again, I'm Katina.
I'm Vernon.
And together we are here to.
We're actually here to help you with your Medicare off the Medicare. Any of our seniors deal with problems, they just don't know. We're here to actually break that down and help you understand how those letters actually work.
Oh, it looks like we do have some people here.
Okay.
If
you are coming in, it'd be nice to know where you're from.
Where you from? You can put in the chat where you from, what state.
Say hi.
Say hi, what state, what city you're from.
Have two viewers.
Yeah, you can, type in the chat where you from. City, state.
It's our first time going live, so learning.
All right, just where you from, anything in the chat. I mean, we are talking about Medicare, so.
It'd be nice to talk to.
Yeah, it'd be nice. So we have two. I mean, if you could put where you're from, state, city. All right, we got one. All right. All right. I guess the other one didn't want to. Okay. In Pooler. Hey, Sharon. How are you? I've never been to Pooler, Georgia.
How close is that to Atlanta?
Yeah, how close is that from Atlanta? I've never been there before. Pooler, Georgia. I've never heard of it.
Pooler. A cool city, man.
I'm gonna have to Google that. Put it on Google Maps. Where is Pooler, Georgia?
Hello.
Yeah.
We were just asking how far is about 4 hours.
4 hours?
Atlanta.
Okay. Awesome.
All right,
Sharon. Well, it looks like it's us. So
we might have some more people coming in.
Yeah, we may have. Yeah.
If you have any questions about this, like we just stated before,
Savannah. Okay, I know where that is.
So, if you have any questions, we actually here live answer those. But what we're going to be doing today is we're actually going to break down ABCs of Medicare. We can understand what is going on, letters, how they work for the individual.
And also, this isn't just for people who are already 65. It's for people who are turning 65, or if you're a child, not even a child, but you're helping your parents out, or you're already enrolled and you're confused. I've had a lot of my friends, millennials, Gen X, helping their parents out. So this is for them as well, because it can be very confusing. But be sure to, if you haven't already, to like, subscribe, and hit that bell so you don't miss our other sessions, because we will continue to have sessions for you guys.
Now, Sharon, are you on Medicare currently? Okay.
Keep
Well,
going.
that's
All right. So let's start with the Medicare alphabet. All
Okay.
right. So we're gonna start with the first
Well,
beginning.
let's show who we are.
Oh, yeah.
And let's
Oh well, one person
go
came
here.
back. So
Here
all
we
right.
go.
So I'm Katina.
I'm Vernon. Once again, we actually were educators in the public education sector. We were here. We were in Chicago for about
Yeah.
a decade. I taught music education.
I taught special education.
Yeah, and what we've done is we actually built our business learning how to teach seniors Medicare first. Then we've taken our skills and talent over here. We actually are members of a council called the Council of Financial Educators, where we are here actually certified seniors how their Medicare works.
Sharon said, yes, I am. So what did you ask? If she was 65?
Oh yeah, I just actually she was retired.
Okay, awesome. Are you enjoying retirement? I heard it's a beautiful thing. Vernon, your voice goes in and out.
Oh, thank you.
Thank you for letting us know that,
Let
Sharon.
me fix that now.
Can you
'cause
hear
this-
me loud and clear? Because I'm generally the loud and clear
Yes,
person.
she is.
Can you
Oh.
hear me loud and clear, Sharon? Let me know. Can you hear me loud and clear, Sharon? Yes. Awesome.
All
Okay.
right. What about now? Is that good, Sharon? Am I going in and out still? And then we're gonna get going.
You said, yes, you are clear.
All
Awesome.
right. So, like I said, we are educators, and we're gonna get to it. So we're not gonna do too much.
Get right
yabbing.
into it.
Now, if you got any questions, go ahead and put in the chat, Sharon, because you're the only one here.
Yeah, you here, Sharon, so you can ask all you want. This is your personal private session.
All right, here we go.
This is your personal private session, Sharon. So any questions, don't even hesitate to ask. Oh, we got another person in.
Okay, that's good.
We know that Sharon is here, but for our other viewer, just let us know what state you're from, and so that we can all get it going like a family here. All right, so we're gonna get started with the ABCs. It's not easy as 1, 2, 3 like the Jackson 5, but we're gonna help you out. So Part A, Medicare Part A is your hospital insurance. So what does that mean? It covers inpatient, which is the nights that you stay at the hospital. It covers your skilled nursing and hospice. So any of those things where you're staying overnight in those type of hospitalizations or institutions, Part A covers that. Now, generally that premium, there is no premium for your Part A as long as you worked at least 10 years and above, but at least 10 years as at a minimum. That's our Part A, okay? Inpatient and hospital. Everybody got me with Part A? Okay. Now, our Part B is your doctor visit. So once you're going to the doctor or anything the opposite of inpatient, so they call it outpatient. So that's your doctor visits, your preventive care services, if you're going in for physicals or anything like that, and your outpatient care. Now, Part B as in boy, is a very important and essential part of Medicare. Why? Because that's where your premium is, and a lot of your salary is based on that premium. So generally the premium for 2025 has been $185 a month. And unless IRMAA applies, and IRMAA is like a completely different live at another time. We can talk about IRMAA for like 30 minutes. So that would be a completely different live, but that's your Part B in a nutshell, your outpatient care. Now, when we get to Part C is both A and B. So A and B is your original Medicare. So once you turn 65, you have your Part A and you enroll in your Part B, you pay your premium. Your original Medicare is A and B only, okay? In order to get Part C, you have to make sure you have A and B, okay? And your Part C is what we call the Medicare Advantage. So that's when you still have, of course, your outpatient, inpatient, things that I just listed, but it also is a bundled package. So it includes your vision, your dental, your hearing, and sometimes over the counter, but it really depends on the plan that you're on. Now, you can, and with Part C as well, it can include Part D. Not all Medicare Advantage includes Part D. Part D is D for drugs. It's your prescription costs. So, but not all Medicare Advantage included. You can get a Medicare Advantage without prescription drugs, and you can get a Medicare Advantage with prescription drugs. Okay, it really depends on the need. Now, you must have Part D though. You must have it. Those plans that don't have Part D, those Medicare Advantage that do not have Part D, is because they may be, just an example, they may be a veteran and have prescriptions filled through the VA. Yeah. So that's when they would get a Medicare Advantage without prescription drugs. But other than that, even if you turn 65 and you say, I don't have any prescriptions and I'm still working and I'm just on Medicare, you still need to have Part D because there will be a penalty for the rest of your life.
We had probably about 5 of our clients in that situation.
Yes.
We've had to fight to get their penalty either removed or kind of decreased. So that is a very, very important key to getting into Medicare, is making sure that you have Part B and D together. We have some people that just on Part A and they think they have it and they really don't. So
I see we have some more viewers. If you guys could
come in, if you're coming in,
just say where you're from, say hi. You know, we want to, it's a Q&A, so you guys can ask us questions. You can talk to us. I promise we don't bite. We don't virtually bite.
We are real people.
We are real people. So you can just come in, say where you're from, say hi, and all of that. All right, so we can keep going. I'll watch the chat, but we can keep going because now that we've pretty much talked about the ABCs, which is the first part, which is mainly Medicare Advantage. If you have any questions, you can ask for any of the questions that I just, from the information I just told you. But now we can go toward the rest of the alphabet.
Right. So when you're talking about original Medicare, the reason that people get C is to complete the Medicare. So yeah, original Medicare is what they call, if you look on one of our posts, it says, one of the ladies said it's real Medicare. Yes, that's the Medicare that covers 80% of your cost. It's the 20% that it has gaps. And when you get into a Medicare Advantage or Medigap plan, which is what I'm about to talk about.
Crystal, but hey, Crystal. Sorry about that. Sorry, babe.
that fills the gaps to make sure that your plan is complete. Okay. So this is the Medicare alphabet that confuses a lot of people. Okay. Knowing A, B, C, D, F, G, K, L, M, and N. So this is the Medigap alphabet. The other one was the Medicare alphabet, which is just really simple. It's not a whole lot to look at and know what's covered and what's not covered. It's very simple. A, B, C, D. If you get C, it's going to include A, B, and D, and that's it. You don't have to worry about it. You only have one card for that type of Medicare. In this case, you're looking at your Medicare card, you're looking at a supplement card, as well as you're looking at getting a separate prescription and drug plan card. So there's 3 cards for this Medigap plan. Now, the difference between the Medigap and your other plans are, it's a premium that comes all the time. So these are the plans that you look at. So you see squiggly lines through Plan C and Plan F. Now, Plan C and Plan F have a squiggly line through it because if you did not have Medicare before 2020, you cannot qualify to get this. So, most of our clients that we've dealt with are either just turning 65 or they only been on Medicare maybe like 3, 4, 5 years. So the plans that we kind of look at, so we only really generally look at a Plan G. And if you guys look at the chart, you'll see why. That Plan G is highlighted because the Plan G basically takes care of every single thing that you have to deal with in Medicare except for the Part B deductible, which this year was about $257. That's a year. So you pay that $257 and you don't have to pay anything else. That also comes with a foreign travel emergency, so you can get 80% of that covered, as well as 100% for every single thing else. Now, some of our clients actually go with a Plan N. The reason they go with a Plan N is because it's a little cheaper, but we don't talk about the Plan N much.
I have AB. So, Ms. Sharon, I can answer that for you. So if you only have AB, with the Advantage plan, you'll still have some copays and deductible, and depending on your network, you can be in an HMO and a PPO network, but there'll still be some things that you'll have to pay.
Yeah,
and
she's actually moving on to our next slide.
Yeah,
So,
our next slide is that, but there will be some things that you will still have to pay, Miss Sharon, because you only have original Medicare. With original Medicare, only having original Medicare, there are a lot of gaps.
Yes, and we're gonna talk about a little.
We're gonna talk about those gaps right now, but
we can't talk about all of it. But we can talk about
a few
some
of them. But
yes.
just having original Medicare, this is what you have. There, it comes with gaps, and he's gonna talk about a few of those.
All right, so now these the Medigap and the Medicare Advantage plan are private entities. They're private insurance, but having them save you money. Okay, they will save you money in the long run. Medigap will save you money in the excess of 15% or the 20% that cannot be capped. If you just have original Medicare and something were to go wrong, Miss Sharon, you will be responsible for 20% by yourself with no other coverage to fill the void. So when we look at the original Medigap, your doctors they take anybody that takes Medicare, you can go to. So this is a very straightforward plan. Once you have it, you're paying a high monthly premium, but every single doctor in the world, no matter where you are, you can go to. So if you need a specialist that's in New York City and you want to go see this specialist for a situation that you have, your Medicare will take it. As far as your drugs, you have to go ahead and buy that separately. As your cost, like I said, high premium, lower out of pocket for things that you got to get done in the hospital. So
Miss Sharon, do you said you have A and B. Do you have Part D for prescription drugs? I mean, we could keep talking while we wait for the answer, but dude, I was wondering if you have Part D, and we can go further on that too, along with your A and B. But
yeah, and like I said in the chart below, the chart from before, your travel is good for U.S. travel. So anywhere you go in U.S. and you get 80% for foreign travel. Now the Medicare Advantage, Katina is our specialist in that. So babe, go ahead and explain how Medicare Advantage works.
Well, so pretty much neither one is one size fits all. It definitely depends on three things: your health, four things: your health, income. I must do because my prescriptions are paid in full.
Okay, good.
All right, so that's good because we wanted you to avoid those penalties. All right. So neither one of those plans, whether it's Medigap or Medicare Advantage, neither one is one size fit all. They're both good plans. Now, a lot of people hate one or hate the other, but it really depends on four things: your health, your income, your lifestyle, and your budget. As he explained, you're paying monthly for your Medigap policy and on top of the Part B. So it's the Part B premium on top of the premium for your Medicare supplement. With your Medicare Advantage, you're only paying for Part B, and your Medicare Advantage can be no cost or like a couple of bucks, like not really expensive. So either one though, they both work, but it just depends on those factors. Now, when it comes to Medicare Advantage, you do have to worry about your network. There's an HMO and a PPO network, so it's not as broad as Vernon explained with Medigap, that you can go anywhere nationwide. Like with Medicare Advantage, generally for like emergency, if you were in another state, you could use your Medicare Advantage plan for that, but not like a specialist in New York, as he explained. And your prescription drugs are generally included. So if you're not a person that already has access to prescriptions through other places, just such as our veterans, then your prescription drugs are generally included. Unless, like you, Miss Sharon, you have A and B with a prescription drug plan. So you said you must have it. So that means you have it. And then, of course, it's the cost. Again, Medicare Advantage is about affordability. So lower premiums and copays apply. So of course your premiums are low, but there are copays every single time you go to the doctor, depending on like where you go. It may be little, it may be a lot. It really depends on your plan. And then lastly, travel. It's limited. It's based on the plans in that area. And like I said, if you're traveling somewhere, they'll always give you access to the emergency room with a Medicare Advantage plan. But if you're trying to see other doctors and other specialists in other states, it's not the same with the Advantage plan.
All right. So that is basically our get up or what we trying to tell you.
The gist of today. Do you guys have any questions? Because it is a Q&A.
Yeah, we have 6 people on. Is there any questions that anybody may have?
Any questions you might have with the 6 people on? I mean, we heard from Sharon. We heard from Crystal. Sharon's in Georgia. Crystal's in Texas. What about our other 4 people? Anybody from anywhere else?
Anybody want to say something
Anybody
in the
want to
chat?
say anything in the chat? It is a Q&A.
Know.
Don't be afraid. We do not bite or virtually bite.
Okay. All right. Miss Sharon, do you have any questions?
Yeah.
Yeah, because you've been
anybody.
You've been
Yeah, she's been talking. Crystal has some questions. Anybody? I know Crystal probably was looking for other people. We have 7 now. Does anyone have any? All right. California. Angela. I think didn't we?
Is it Angela? Well,
thank you for joining us, Angela, from all the way from Cali. Thank you for joining us.
Which part of Cali are you from?
Which part are you from? We've been to Cali a few times, but which part are you from? The name Angela, that sounds familiar. Okay. Anybody else?
Anybody else?
Any questions? It's Q&A, guys. Don't be afraid.
We almost done. No problem. No problem, Angela. We're here to help in any kind of way that we can.
San Francisco. We haven't been there yet.
Yeah, we've been trying to get there.
I want to go.
Yes.
I want to go to the Bay Area.
I have a lot of family in San Francisco.
And I heard they have like Bridge is a place to go to.
Yeah, they told us something about the bread there. They have some kind of like, is it Filipino bread?
I don't know anything. They probably told you that. I don't remember hearing
Star bread. I think they call
that.
it star bread.
Now we have 8 people. Anybody? Any questions or what state are you from? What did she say? Is it too late to apply for a Medigap plan, or could I change at the beginning of the new year?
Okay, so Miss Sharon, we have your information. What we can do. Okay, thanks, Crystal. We appreciate that for sure. What we can do, Miss Sharon, we can actually give you a call. Because I would rather that those are more detailed questions, and we have to ask you questions to know where you are, to know if you would qualify to get a Medigap plan. So I wouldn't want to ask those questions on live. We could give you a call here probably. We'll text you right after the live and see if we can set up a time to talk to you. As of right now, let's go ahead and look here at our drawing, because we do have a drawing that we have to give away a free gift card. And Miss Sharon, I think you're the only one here on the list.
I mean, unless someone else is here, because we do have other people here.
Yeah.
So unless you're here, you're missing out on your gift card.
So I'm looking at is there a JoJo Stevenson here? Is there a Lisa Wright? Michelle Sales? We have Sharon Howard, Edward Collard, and Karen Klaustreich.
I don't think that's how that last is. Thank you for supporting Crystal. And is Mama turning 65 already? 65, or is looking for a different plan? I mean, she probably is over 60. I don't know how old Mama is. I mean, unless she's the same age as my mama. My mom is in her 70s. So,
all right. So we didn't hear anybody else, Miss Sharon. So when we text you, we're gonna be getting your address and stuff so we can send you your. Well, we should do probably gonna do a virtual one.
A virtual, yeah.
But we'll talk about which one you want. You got some options.
Whatever gift card you would like.
So we would like to thank everybody that came through tonight. You don't even have any competition, Miss Sharon. That's good for you. You got information,
but
and you got
came to support and for her mom. So I appreciate you, Crystal, for doing that, Miss Sharon. And actually, I want to give it up to our daughter upstairs. She was actually able to be quiet this entire live.
Yes,
she was quiet and in her room.
We are new parents.
We're new parents, but she's been doing her thing.
Okay, so Miss Sharon, you go ahead and be looking out for us to give you. Is it okay to call you after we get off the line, Miss Sharon?
It's 6 there or is it 7 there in San Francisco? She turned 65 in February, March, April, May.
Yeah.
Crystal, we might be reaching out to you. Did she already sign up for her Medicare? Because in one of our videos, we said you can sign up 3 months before your birthday and 3 months after.
Right, but it's May.
March, April, May.
But she's in Texas. There's a.
Oh yeah, it is SCP, right?
What,
so you may be able.
If mom is in Texas, I don't know if she's. Okay. All right, Miss Sharon, we'll give you a call. We want to thank everybody who viewed today.
Yep. Even if they just viewed, this is our first live, first of many.
Yeah, we will be back on. We wanted to come on here 30 minutes and ask any questions that we could for our seniors or answer any questions that we could for our seniors and making sure.
You said go Journey.
And making sure that they are properly educated. We want to thank you guys for coming, and that's it.
And Crystal, you can either reach out to us if your mom hasn't, if she still needs assistance, even though she turned in February, turned 65 in February. If she has anything set up, we can reach out to you or you text us. Either way, you know. Yeah, I don't know. She's in Chicago.
Oh, okay. Yeah, we definitely do a lot of stuff in Chicago.
Yeah, we do a lot of Illinois. So,
all right, everybody, you guys have a blessed day, and we will be back.
Don't forget to like, subscribe for more lives that we'll be having, and we'll be shooting out more education every day as we have.
All right,
thank you guys.
Marriage gets hard when you disagreeing. When God's in the center, he's refereeing. Talk about triggers and traumas while having date nights at the gym and the sauna. To business meetings discussing the health of the wealth to the season of commerce.
New